It's a good chance for us to have here the Professor Michael Prietor. We can ask a question now. Could you talk us about the last news concerning the minimally invasive surgery in pediatric urology?
Well, there's many new things. I think one of the main things is that now there's an increased incidence of using living donors for kidney transplants. And I think one of the reasons why that's starting to happen is because we can do the laparoscopic nephrectomy now. So when somebody is donating a kidney to their child, to their son usually, or brother or nephew, if the donor surgery is done with minimally invasive techniques, people are less reluctant to donate. It's a little bit easier, whether it is with a small incision, lumbar incision, or with laparoscopic procedure. I mean, I think it makes a big difference for the donor, and that's one of the ways that we can do this. There's other minimally invasive surgeries for urology and for all the other specialties that are coming up of age. The use of the Da Vinci robot too has a major impact that we're going to be seeing over the next few years with new techniques using this new modality.
Could you describe us the hand-assisted technique?
Well, it's one of the minimally invasive techniques used for living donor transplants. The hand-assisted technique basically, since you have to make an incision to get the kidney out, you cannot do this pure laparoscopic without making an incision to get the kidney out. With the hand-assisted, what you do is you make the incision at the beginning of the case. You can put your hand inside the abdomen, and then you can use that to basically help you with the surgery. So that's why it's called hand-assisted. I use my left hand, I put that in, and then the right hand is used using laparoscopic instruments and using laparoscopic technique.
Where and when the hand-assisted technique was used for the first time?
The hand-assisted technique was, the laparoscopic nephrectomy was first done in 1992 at Johns Hopkins in Baltimore. A few years later, somebody, and I actually don't have the date, developed the hand-assisted technique, so it was posterior to that. And when we started at Mayo Clinic, where I work, we started in 1999, and we have done now about 2,000 laparoscopic nephrectomies, with the hand-assisted technique. And I think it's maybe a safer technique, it's easier to do, easier to learn, and that's why we have adopted this technique.
Is the living donor technique a good idea in Italy to be performed?
Yes, I think that in this regard, probably the United States has been a little bit ahead of most of the countries in Europe, except for the Scandinavian countries, who have a very strong, important living donor programs. In my hospital, we perform approximately, at Mayo Clinic, 85% of our kidney transplants are from living donors. That's very unusual. In the United States is about 45%. In Europe is less than 10%. And that's changing. I think it's important, both Italy, my own country of Spain, Germany are increasing, I think, these days the number of living donors for two reasons. One is better for the patient. To get a living donor kidney will usually work immediately right away and will probably last a lot longer than a deceased donor kidney. And second, there's not enough kidneys for everybody, so patients usually have to wait on the waiting list for a long time. If they get a living donor kidney, they can sometimes avoid dialysis completely and definitely get a transplant a lot sooner. So those are the main reasons why we feel, where I work, that living donor transplant is very important and should be done in most patients. And I think there's a little bit of a feeling in Italy and in France and Spain and Germany and many countries that traditionally have done very few living donors, that this is a technique that needs to be done more and more.